and welcome to Diabetes Connections in the News. I'm Stacey Sims, and these are the top diabetes stories and headlines of the past 7 days. All sources are linked up at diabetes-connections.com when this airs as a podcast. In the News is brought to you by T1D Exchange. T1D Exchange is a nonprofit organization dedicated to improving outcomes for the entire T1D population. Our top story, some tough news about racial disparity in diabetes. Black children with type 1 experience disparities in health outcomes compared with other racial and ethnic groups with similar neighborhood opportunity profiles. That's according to a study published in the Journal of the American Medical Association Network Open. This was a very big study, more than 70,000 patient encounters. So that means interactions with patients, not 70,000 patients, but a very big number. All the kids under the age of 21 from 2009 to 2018. And they looked at something called the Child Opportunity Index. This combines data from neighborhood-level indicators like good schools, parks and playgrounds, clean air, and safe housing. And they found that the probability of readmission to the hospital within a year was significantly higher among Black children with a very low Child Opportunity Index category versus Hispanic children and white children at the same category. These researchers say doctors and educators need to be aware and include interventions that target racial disparities. Another new study suggesting that people of certain racial ethnic groups should be screened for diabetes at lower body mass index than white people, a recommendation that contradicts recent guidelines from the United States Prevention Services Task Force. At a time when a lot of medicine is trying to rid itself of race-based tools, this can be tricky, but these researchers say using a one-size-fits-all approach to screening when diabetes is 2 to 4 times more prevalent and more deadly in Black, Hispanic, and Asian Americans is likely to result in underdiagnosis of the disease and widen health gaps. There's a new partnership between JDRF, Yale University, and a company called NexImmune. That company has something called Artificial Immune Modulation Nanoparticles. And the idea here is to see if that could work with Teplizumab to delay or prevent type 1. Teplizumab is already being tested as a prevention method. It is back in front of the FDA. NexImmune says its wider plan is to use the body's own T cells to generate a specific immune response to prevent not just diabetes, but other autoimmune conditions and even cancer. Oramed Pharmaceuticals announced this week it has enrolled 100% of patients in the world's first phase 3 study of oral insulin. This is being looked at for just type 2 right now, and they're comparing the efficacy of ORMD 0801 to a placebo in improving glycemic control. And then they want to see if there's a change in fasting glucose at 26 weeks. They hope to announce the first results in January of 2023. New partnership between two diabetes heavyweights, the Diabetes Research Institute, DRI Foundation Canada, and Alberta Diabetes Institute have announced a research partnership. The CEO of DRI says, type 1 knows no borders or boundaries, nor should the research to find a cure. There's a lot of research funded by these groups, of course, including islet and stem cell transplantation. Right back to the news in a moment, but first, In the News is brought to you by T1D Exchange, and the T1D Exchange Registry is an online research study designed to harness the power of individuals with type 1 diabetes. It's a research study conducted online over time, designed to foster innovation and improve the lives of people with T1D. Personal information remains confidential. Participation is fully voluntary. Once enrolled, participants will complete annual surveys and have the opportunity to sign up for other studies on specific topics related to T1D. By sharing opinions, experiences, and data, patients can help advance meaningful T1D treatment, care, and policy. Sign up at t1dexchange.org/Stacey. That's t1dexchange.org/STACEY. Back to the news, and Insulet's CEO is stepping down. Stacey Petrovic has been in the role since 2019, and she says she's stepping down June 1st for family reasons. Petrovic will stay on as an advisor for the next year to aid in the transition and support of the company's launch of Omnipod 5. She'll be replaced by Jim Hollingshead, who's been on Insulet's board for the last 3 years. He has been the president of ResMed for the last 12 years. That's a company that focuses on advances in sleep medicine. I feel like I haven't done a newscast in a few weeks without mentioning model Lila Moss, and here we go again. After being on the cover of UK Vogue and making headlines at the Met Gala, she's now showing off her Libre and Omnipod in a new Fendi and Versace ad campaign. And I've got an update for you on T1D the movie. We talked about this a few months ago. Star Trek actor Noah Auerbach-Katz is producing a short film with type 1 at the center. he started a Kickstarter campaign and got a wonderful response from the Star Trek community, which, along with the diabetes community, fully funded the project. I got an update. He is starting filming this week. And he says if you back the project at the level where you would get some kind of token of appreciation, they are working on those too. So more to come. And an interesting find on the toy front. I had never heard of Squishmallows. Squishmallows? It's Squishmallows, I think is how you say it. But people say these stuffed toys are soothing. Others say it has just been a social media marketing thing. There's nothing inherently special about the plush toys. Either way, one of the limited edition Squishmallows is being marketed as having type 1 diabetes. Now, there's nothing on the toy itself to show that it might use diabetes technology. It doesn't wear a Dexcom. It doesn't have anything like that on it. It's just listed in the toy description online. I'm trying to find out the story behind this. So let me know if you know anything. It's really cute. I'm just curious. None of the other Squishmallows seem to have medical stuff going on with them. So why this one and why type 1? On this week's long format episode, we are talking to Dexcom's Chief Technical Officer, Jake Leach, about the G7. That episode came out a couple of days ago, and it has been very popular. I got to tell you, one of the top download days ever for this show in 7 years. You all are, just like we are, very interested in the upcoming G7. Can't get here fast enough. And I did try to ask Jake as many of your questions as I could in the limited time that we had. Of course, we'll follow up as much as we can. And then next week's show, we're talking to the new CEO of Beta Bionics. Did you know this? They kind of shuffled things around. I know many of you follow Beta Bionics very closely. Ed Damiano is not their CEO right now. So we will be talking to her, the new CEO, and asking your questions about Beta Bionics. They have submitted the islet to the FDA, so there's a lot to come on that. And you can listen to those episodes wherever you get your podcasts, wherever you're listening to this one now. And that is in the news for this week. If you like it, please share it. Thanks so much for joining me. I'll see you back here soon.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.